Hello everyone, welcome to this channel, and today I am going to discuss about hemophilia briefly. So what is hemophilia? Basically it is an sex linked disorder which is group of sex linked disorder which is inherited, and it is featured by prolonged clotting time, and usually it affects the males, the females here being the carriers. Now because of the prolonged, because it is an X linked disorder, and basically in case of females there is 2 X chromosome, and in case of males there is 1 X and Y chromosome. That's why it is predominant in case of the males, and females are the carriers. And because of the prolonged clotting time, in case of hemophilia even a mild trauma can cause excess bleeding, and ultimately the person may also die. Now in case of hemophilic patient, the extraction of tooth may also cause excess bleeding. It can last up to few weeks. In case of the patients, they face easy bruising and hemorrhage in case of their muscles and joints, and these are very common. Now there are certain causes of hemophilia. Basically it occurs due to the lack of certain clotting factors, which ultimately prohibit the formation of prothrombin activator, which is the preliminary step for the blood clotting to take place, and that is why in case of those patients the clotting time is, or coagulation time is, prolonged. In case of this patient, however, the bleeding time is normal. Now as I have said earlier, there are deficiency of certain clotting factors which may lead to the lack of formation of prothrombin activator. Now there are 3 factors which lead to hemophilia. These are factor 8, which is also known as anti-hemophilic factor, factor 9 or Christmas factor, and factor 11. Or so in case of hemophilia C factor, or which leads to hemophilia C. So in case of classic hemophilia, the hemophilia or hemophilia A, the factor 8 is involved, and the deficiency of this factor leads to classic hemophilia, and which covers about 85% of the people with hemophilia. Hemophilia B or Christmas disease, it is due to deficiency of factor 9, and 15% of the people with hemophilia suffered from this disease. Now hemophilia C or deficiency of factor 11. Now it is a very rare disorder, and it occurs rarely due to deficiency of factor 11. Now there are certain symptoms by which we can say that the patient have hemophilia. These are: the patient may have spontaneous bleeding, the patient may face prolonged bleeding due to some injury or extraction of the tooth, or any case of any hemorrhage. Now in this patient, the hemorrhage also occurs in the internal organs like the GI tract and urinary tract. In case of these patients, there is bleeding in the joints which causes excessive swelling and pain. These patients may also face the occurrence of blood in their urine due to hemorrhage in the urinary tracts. Now treatment for these patients include the replacement of missing clotting factor, especially in case of classic hemophilia or hemophilia A disease. So this is a brief discussion regarding hemophilia, and here I am ending my today's discussion. See you in my next video, and if you guys like the videos, please subscribe the channel. Thanks for watching.